If a thyroid nodule was found on your thyroid ultrasound, you may be wondering, what causes thyroid nodules? Why did I develop a thyroid nodule? And does having a thyroid nodule mean cancer? These are some of the most common questions people ask after an unexpected thyroid ultrasound finding. Let's begin with a clinical story. A woman once came for a consultation after an ultrasound unexpectedly found a thyroid nodule. While waiting for her appointment, she searched through online resources. By the time she arrived, she was frightened and confused. She wondered whether the nodule was caused by thyroid cancer, Hashimoto's thyroiditis, iodine deficiency, or one of the many other conditions she had read about. Her search results included common causes, but also several unusual conditions that doctors rarely see in everyday clinical practice. The information was not necessarily incorrect, but it lacked clinical context. Her real question was simple: what actually caused my thyroid nodule? In this video, we will explain the causes doctors see most often. These include benign thyroid tissue overgrowth, solid and cystic thyroid nodules, Hashimoto's thyroiditis, iodine deficiency, multinodular goitre, and hot thyroid nodules. We will also explain why, in many people, one exact cause cannot be identified. Perhaps you have asked yourself, did I cause this? Was it something I ate? Was it caused by stress? Does having a thyroid nodule mean cancer? The first important answer is reassuring. In most people, a thyroid nodule is not caused by one particular food, action, or mistake. You probably did not do anything that directly caused it. So, what causes thyroid nodules? Let's begin with one of the most common explanations: benign overgrowth of thyroid tissue. One small area of normal thyroid tissue may gradually grow more than the surrounding gland. As this area becomes larger, it forms a separate lump or nodule. This is called benign thyroid tissue overgrowth. You may hear terms such as colloid nodule, hyperplastic nodule, or thyroid adenoma. These names may sound concerning, but the basic meaning is simple. A small area of thyroid tissue has grown more than usual, but the growth is benign. This is one of the most common explanations for a solid thyroid nodule. The exact reason why one area begins growing more than the rest of the thyroid is often unknown. Aging, inherited tendencies, long-term stimulation of the gland, and small changes within thyroid cells may all contribute. The key message is this: the word solid describes what the nodule is made of. It does not automatically mean thyroid cancer. Many solid thyroid nodules are caused by benign tissue growth. A solid nodule may remain stable for many years. However, some solid nodules gradually change, break down, or develop fluid inside them. This leads to another common question: what causes a thyroid cyst? Many people imagine that a thyroid cyst begins as a simple pocket of fluid. However, many thyroid cysts begin as solid benign nodules. Part of the solid tissue may later break down and become filled with fluid. Doctors may call this cystic degeneration. In simple terms, it means that part of a solid nodule has broken down and fluid has collected inside it. Small blood vessels inside the nodule may also rupture and bleed. This can make a thyroid lump suddenly become larger, tender, or painful. Consider another clinical story. A woman once presented because a thyroid lump had become noticeably larger and painful over only a few days. She was frightened because she believed that rapid growth always meant thyroid cancer. Her ultrasound showed a partly fluid-filled thyroid nodule with bleeding inside it. The sudden swelling was caused by blood and fluid collecting inside an existing nodule. It was not caused by a new tumor suddenly developing over a few days. The lesson is important. A thyroid lump can enlarge rapidly because of internal bleeding or fluid formation. Sudden enlargement does not always mean cancer. However, a painful or rapidly enlarging thyroid lump should still be medically assessed. Some nodules become almost completely filled with fluid. These are called cystic thyroid nodules. Others contain both fluid and solid tissue. These are called partly cystic nodules, or solid and cystic thyroid nodules. Therefore, one answer to the question, what caused my thyroid nodule, may be that a previously solid, benign nodule gradually broke down, filled with fluid, or bled internally. Now let's move from physical changes inside a nodule to inflammation. Can Hashimoto's thyroiditis cause thyroid nodules? Hashimoto's thyroiditis is an autoimmune condition. This means the immune system mistakenly attacks the thyroid gland and causes long-term inflammation. Over time, this inflammation can make the thyroid swollen, uneven, or lumpy. Some inflamed areas may look like nodules, even though they are not separate growths. Doctors sometimes call these pseudonodules. A pseudonodule simply means an inflamed area that looks like a nodule, but may not be a true separate lump. People with Hashimoto's thyroiditis can also develop genuine thyroid nodules. However, Hashimoto's does not explain every thyroid nodule. Having Hashimoto's also does not mean that a thyroid nodule is cancerous. The simple explanation is this. Hashimoto's thyroiditis may contribute to a nodular thyroid because long-term inflammation changes the structure of the gland. But many people with thyroid nodules do not have Hashimoto's thyroiditis. Another possible cause depends partly on where a person lives and whether their diet contains enough iodine. Can iodine deficiency cause thyroid nodules? Yes. The thyroid needs iodine to produce thyroid hormones. If iodine intake remains low for many years, the thyroid may have to work harder to maintain normal hormone production. The gland may then receive repeated stimulation to grow. Over time, the whole thyroid may become enlarged. An enlarged thyroid gland is called a goitre. At first, the thyroid may enlarge relatively evenly, but after many years, some areas may grow more than others. Separate nodules can then gradually develop. This is one explanation for multiple thyroid nodules. When an enlarged thyroid contains several nodules, it is called a multinodular goitre. A multinodular goitre usually develops slowly over many years, rather than appearing suddenly. Some nodules remain solid. Others may develop fluid, old bleeding, or scarring. Iodine deficiency is less common in places where iodized salt is widely available. However, it remains an important cause in some parts of the world. The key message is that long-term iodine deficiency can repeatedly stimulate thyroid growth and eventually contribute to multiple thyroid nodules. However, taking large amounts of iodine, kelp, or so-called thyroid support supplements will not reliably make an existing thyroid nodule disappear. Too much iodine may also disturb normal thyroid function. Now let's look at a completely different type of thyroid nodule. What causes a hot thyroid nodule? A middle-aged man once came for consultation with a fast heartbeat, increased sweating, heat intolerance, and unexplained weight loss. He believed that his symptoms were caused by work-related stress. During the examination, a small thyroid lump was noticed. His blood tests showed that his thyroid was overactive. Further investigation identified a hot thyroid nodule. The nodule was producing thyroid hormone by itself. Finding the underlying cause connected his apparently unrelated symptoms to one overactive thyroid nodule. It also allowed treatment to focus on the actual cause rather than treating each symptom separately. So, what causes a hot thyroid nodule? Normally, the thyroid produces hormone according to signals from the brain. In a hot or autonomous thyroid nodule, one group of thyroid cells begins working independently. The nodule continues producing thyroid hormone even when the body is signaling the thyroid to slow down. A small hot nodule may not initially cause any symptoms, but if it becomes larger or more active, it may produce too much thyroid hormone. This can cause palpitations, shaking, sweating, anxiety, heat intolerance, or unexplained weight loss. When one overactive nodule produces too much thyroid hormone, it may be called a toxic thyroid nodule. When several nodules become overactive, the condition is called toxic multinodular goitre. The key message is that a hot thyroid nodule is not simply a lump. It can also affect thyroid hormone levels and produce symptoms throughout the body. Can thyroid cancer cause a thyroid nodule? Yes, thyroid cancer can cause a thyroid nodule. However, it is not the most common cause. Most thyroid nodules are benign. Benign tissue overgrowth, cyst formation, bleeding, Hashimoto's thyroiditis, iodine deficiency, and multinodular goitre are all more common explanations. Many patients begin searching online with the fear of cancer. They then view every other possibility through that fear. But finding a thyroid nodule only tells us that one area of the thyroid is different. It does not by itself identify the cause. Doctors therefore consider the patient's medical history, thyroid blood tests, and ultrasound findings together. So, what caused my thyroid nodule? Let's summarize. In many patients, one exact cause cannot be identified. The nodule was usually not caused by something the patient deliberately did. Common causes include benign overgrowth of normal thyroid tissue, fluid or bleeding within an existing nodule, long-term inflammation from Hashimoto's thyroiditis, long-standing iodine deficiency, multinodular goitre, and a hot thyroid nodule that produces hormone independently. Thyroid cancer can also cause a nodule, but it is a less common explanation. Remember these key messages. A solid thyroid nodule is often benign tissue that has grown more than the surrounding gland. A thyroid cyst may form when part of a solid nodule breaks down, fills with fluid, or bleeds. Hashimoto's thyroiditis can make the thyroid inflamed and uneven, sometimes producing true nodules or areas that resemble nodules. Long-standing iodine deficiency can cause the thyroid to enlarge and gradually form multiple nodules. And a hot thyroid nodule develops when one area of the thyroid begins producing hormone by itself. If you are holding a thyroid ultrasound report and want to understand terms such as solid, cystic, hypoechoic, or ThyRads, visit the thyroid nodule playlists on our channel for complete A to Z guidance. Please subscribe to the channel and share this video with someone who may be worried about a thyroid nodule.